Okay, so you've taken your NCLEX, you've passed it, now you're a registered nurse. Now what? Well, you got to get a job, right? That's kind of what this has all been all about. So we're going to talk briefly about how to get a job. I'm not going to go into a ton of detail because I honestly believe we don't really have to. But one of the things you're going to want to consider is the job market. The job market for nurses is odd. In some parts of the country, there's huge shortages, particularly in the Southwest and Southeast. Florida, Texas, Arizona, New Mexico, huge needs because that's where the baby boomers are moving to. They're older people or sicker people, they go to the hospitals. They need more nurses. Up by us, there's not a shortage and there's not a surplus. Almost everybody that graduates here gets a job. They don't necessarily get a full-time job and they don't necessarily get their perfect job. But almost everybody that graduates gets a job. And then if it's not the right job or the right shift, then you just keep watching and looking. So it's not as good as it was in the late 80s and early 90s, but it's not bad. If you keep your eyes open, keep talking to people, you will eventually find that right job. And that's an important self-assessment. What is the right job for you? For me, the right job for me changed over time. When I was a new grad, I wanted to do cardiac nursing and nothing but. Over time, I developed the ER nursing and nursing supervision. I would have never considered to be nursing supervision earlier. As an ER nurse, I loved the psych patients and the pediatric patients. Earlier in my career, I hated the psych patients and the pediatric patients. So you will change over time. It's sometimes more important to know what you don't like. And I hope over these last 4 semesters of clinicals, you've kind of decided what you don't like because you can eliminate those as job opportunities. Make a list of pros and cons of what you're looking for. Do you want a real stable schedule? Do you want regular hours? Do you want to work with the same people over and over? Something like that might be a long-term care facility. Do you want day hours but a variety of patients? Maybe a clinic would be where you want to go. There's a lot of different options. And I can't tell you what's right. There are many different opportunities out there. Entry-level or staff nursing positions are at the hospital and acute care settings mostly. Nursing homes are hiring fewer RNs and more LPNs, as are most clinics, although some clinics hire RNs and some RNs work in nursing homes. Charge nurses are in hospitals commonly. Community health, that tends to be more of the BSN type level, along with occupational health and public health nurse. Those usually are BSNs, but not necessarily. Home health care will hire everybody, agency nurses or temporary agencies. So what about going back to school? And I really encourage all of you to consider going back to school as soon as possible. The longer you put it on the back burner and wait, the less likely you are to actually start going. So go get that BSN. Start taking a class or two. There are some places that will not even consider you as an applicant unless you're at least enrolled in a program. All right, so seriously, enroll in a program right away, even if you're taking just one class. After BSN, you may consider a master's degree, especially if you want to consider high-level management or education. One thing I want to point out, there are programs that offer RN to MSN. Marquette University does this. You can have an associate's degree, you can go down there, and by the time you're done, you will have a master's degree. But they do not confer a BSN. And if you want to teach in Wisconsin, by Nurse Practice Act, you must have a BSN and MSN. So if you go to Marquette for that RN to MSN, you cannot teach. There's specialty practice areas. You can become a nurse clinician, a PhD if you want to go into research, or a doctor of nursing practice if you want to become a nurse practitioner. Many, many options. How do you find jobs? The best way of finding a job? Talking to people. Talking to your clinical sites, talking to your instructors, talking to your neighbors who are nurses. Newspapers, not so much. You can do online searches for many places. That works. Mostly, it's going to be who you know and how active you are. When you want to consider an organization, the slide says that you should consider the mission or philosophy statement. I'll be honest, I never did it any place I worked. I'm not saying it's not important, just nothing that I worried about. Reputation of the leadership, something huge though. You want to work for a place that has a reputation of good, fair leadership that treats its nurses well. If you go to a place that doesn't, that their reputation is poor, expect poor treatment. And who really wants that? Now you'll need to write a cover letter possibly and a resume. Cover letter is your brief introduction. 3 paragraphs. 3. Not 4, not 6. 3. First paragraph should say, "Hi, I am so-and-so, I'm applying for this job." The second paragraph, a very brief summary of why you are a good fit for the job. Let's say you were a nurse intern at a OB/GYN facility. Well, if it's an OB/GYN nursing position, you would be a perfect fit because you have that experience. And then the last paragraph, "Thank you for your time. I can be reached at this number or this email address. I hope to hear from you at your earliest convenience." Short and sweet. Address it to a specific person. Do not write it to head of nursing or head of personnel or HR director or nurse manager, because you can find the name of every one of those people with one phone call. You call the hospital and say, "Hi, what's the name of the nurse manager for inpatient care?" They will tell you, and then address it to that person. Your cover letter needs to be an 8.5 by 11-inch paper, white, off-white. That's about it. You're going to be emailing most of these or uploading them online, so it almost doesn't matter. Make sure it's you have no mistakes, none, no typos, no misspellings. Make sure you have your margins are all nice and straight. You want 1.5 to 2 inch margins on all sides. As much white space as possible. Do not cram a lot of information into that 1-page cover letter. No abbreviations, business letter format. Resume, very similar. 1 page. Students can only have 1 page. Seriously, 1. I don't care how many other jobs you've had. 1 page. Now, when you've been a nurse for 5, 6, 7 years, dozen years, maybe then you have 2 pages. But right now, 1 page. And keep it simple. Again, lots of white space, good margins. Keep it current. Define your strengths by what you've done. Make sure that they have a way of contacting you, phone number and email address. List your education first, unless you are currently working as an LPN. Because since that is a licensed professional job, you'd want that first. But if you are not working as an LPN, put your education first, then your work experience. Now, what if you have no nursing experience? If you have CNA experience, that works. If you don't have CNA experience, put down the experiences that you have that cover working with people. Have you been a waiter, waitress, salesman? Great, that's good stuff. If you have you had a job working construction? If that's all you've done, then put that down. You don't want to have nothing there, but you want to focus as much as possible on jobs that work with people. If you have a license, and now by license I mean LPN, EMT, paramedic license. That's it. CPR is not a license. Don't put it down there. So license is, LPN, paramedic, EMT, things like that. Do you belong to any professional organizations, including the LCSNA? List that. Do you belong to organizations that are religious-based? Do not list that. A resume is a quick pass. It's a pass-fail exam that you have about 15 seconds of their time. And they will look at that, and most people will look at those for reasons to throw it down. And to be honest, if you list a church organization, you are risking them throwing it down because you don't know who's going to read it. Now, if you are applying to a religious organization, a religious church, and you have a powerful connection to that same religion, it might be safe to put that down. I don't know if I still would, though. But if you're applying to a non-religious organization and you put down that you are chairman of Saint whatever religion church, you are risking them saying, I don't want a person who feels that strong about their religion. Right? So anything that could be a black mark against you, don't put it on your resume. Don't put your age. Don't put anything from high school. Nothing from high school. You've graduated college. High school doesn't count anymore. I don't care if you're a valedictorian. High school no longer counts when you've been to college. College supersedes high school. And besides, when you put down your graduation date from high school, they know how old you are. And no matter what your age, if you are young, they could say, this person's too young for the job. If you are, say, in your 30s or 40s, they could say, this person's too old for this job. No high school information at all. Don't list marriage, don't list children, don't list church, okay, nothing like that. I know, a lot of things you can't do. I want you to make your resume as basic and as simple as possible. And one other thing, there is mixed opinions on listing clinical experiences. My opinion, every nursing school graduate in this area that graduates from our college has the same nursing experiences, the nursing clinical experiences. So if 5 people from LTC apply for the same job and they all list it down, how are any of them standing apart? They're not. They all look the same. If you are applying at, for example, Holy Family, and you did a lot of nursing clinicals at Holy Family, then I would list it. But if you've been at the random Auroras and Holy Families and Rocky Knolls and stuff like that, you're better off not. You're better off not. Likewise with objective statements. I'm not a fan of them. I'm not a fan because in my mind, a resume is for what you have already done. An objective statement is forward-looking. Your objective statement is actually part of your cover letter. In that first paragraph, I'm applying for the position of RN on the OBGYN floor. That's your objective statement. Don't put it on your resume because you've already said it. Does that make sense? Now, if you want to list an objective statement, I'm not going to take points off. If you want to list your clinical experiences, I'm not going to take points off. Unless that stuff pushes you to a second page. You don't want 2 pages as a new grad. Most likely you're going to either email your resumes and cover letters or you're going to upload them to the websites. You can mail it to managers if you want, and I have. But that's about all you're going to be doing with those. What's the difference between a resume and a curriculum vitae? Curriculum vitae is when you've been working in a field for a number of years and you have a lot of data, a lot of experiences. So when you've been a nurse for 15, 20 years, you'll probably end up with a CV. That's okay. But right now, 1-page resume is all you want. So let's say you submit your resume, they call you for an interview. Cool. What are you going to do at the interview? You want to make sure that you're ready. Rehearse the interview. How are you going to rehearse it? Think of all the possible questions you might be asked and come up with answers. Practice your answers so that you feel comfortable, so that you're prepared. Also, create a couple of questions for yourself. Because at the end of every interview, they will always say, do you have any questions for me? If you say no, which may be true, it could look like the person's not really that interested. Or it could be the person listens so well that they actually do have no questions. But I would still come up with 1 or 2 questions. A really good one, could I have a tour of the unit? That is a great question. Why? Because you seem interested. You want to see where you're going to be working, and you get a chance to see who's there and what it's like. Don't be late. Do not be late to an interview. Don't be too early. 5 or 10 minutes early, great. Half hour early, no. You're overzealous. You're too early. So 5 or 10 minutes early. Dress nicely. For guys, it's going to be, tie, maybe jacket. Ladies, look nice. I'm not going to say you have to wear a skirt or a dress or a suit or whatever, but look nice. Dress up for this. Look the part. Look professional. Shake hands firmly. Be aware of your body language. Do not sit at an interview like this. Smile. Lean forward. Ask if you can take notes. Answer their questions calmly. They may ask you provocative questions to try to get you worked up. Stay calm. Give answers with examples. The more examples of leadership, of management, of delegation, of supervision, of customer and patient service, the more concrete examples you can give, the better picture you're giving them, and the more likely you are to get a second interview or a job offer. Make sure you ask a couple of questions, 1 or 2. Don't ask about salary. Don't ask about benefits at this point. It's not really important at this point. When you're offered a job, then you can talk salary and benefits. Now, if they bring up the salary and benefits to you, fine. But don't be the first person to mention it. You can ask your interviewer for a business card, and I would recommend it. That way you remember their name. Some people like to send a thank you card in the mail. I did once. I didn't on any other job. I did once, though, to my ER job. And after the fact, I was in the job for a few months. I asked her did she receive my thank you card, and she never got it. So, didn't even help. Dress properly. Some things that you're not going to want to do is, no wild nail polish or jangly jewelry or, out-of-date suits, super short skirts. Men, don't wear leather, or nobody wear leather jackets. That's just not appropriate. Guys, you probably should put a tie on. Just common sense, okay? 3 phases to an interview. First phase is just generally putting you at ease. Second phase is really where they are going to dig into you and ask all the questions. Then the last phase is when they summarize the interview and then you ask them follow-up questions. What happens if you get asked a question and you have no idea the answer? Because you will. Here's what you say. That's an interesting question. I'd like to take a minute to think about my answer. Can we come back to that question? I did it when I was interviewed for this job. I got hit with a question. I don't remember what it was, but I do remember saying, I need to think about that. Can we move on to another one? I'll come back to it. A lot of times, by the time you get back to it, your brain will have worked on it and you will come up with an answer. So what about benefits? Are these important? Sometimes benefits are, sometimes they're not. Do you want or need health insurance, dental, vision insurance, life insurance? Do you want all these or not? If not, you might be willing to take a part-time job or maybe take a job that pays a little more with all those benefits. If you have a family, you might want those benefits. But sometimes you may take a little bit less pay. Everything balances out. So what happens if you're offered a job and you don't like it? Say no. Be honest. Say no. If they offer you a job and it doesn't pay enough, or it doesn't give you the hours, or it's the wrong shift, or whatever, just say no. Be honest. Say, I'm sorry, that position does not meet my financial needs. Now, what can happen when you do that is that might, if they really want you, trigger an increased offer. You can also, if you want, say, I'd love your offer and I'd love to work for you, but I need X number of dollars more, or I need tuition reimbursement or something. Now, understand, when you do that, you are giving them all the power to say no. But if it's an honest request, and if it's a fair request, there should be no reason why you can't do that. Be polite. If you are saying no, decline graciously. If they offer you the job and you want it, say thank you. Now, what if they offer you the job and you've got another job? Let's say you interviewed at 2 places at the same time. It is okay to say, thank you for the offer. I'd like 2 days or 3 days to consider it. Keep it short. Don't take weeks, 2 or 3 days. And then what I would immediately do is call your other place and say, I'm not trying to rush you. I've been offered a job at a competing facility. I have 3 days to make a decision there. If I have not heard from you in that point, I'll have to make a decision on that job based on its own merits. Again, you're pushing them a little bit, but you're giving them a reason. You're also increasing your value. Because if somebody else wants you, maybe they should want you too. What happens if you don't get a job offer? Ask them why not. What's the worst that can happen? If they say, I'm sorry, we're not offering you a job, say, I appreciate that, thank you for calling me with that information. Is there something I could have done differently to make me a better candidate? You might get really, really important information. Listen to whatever they say. Didn't have enough experience. Well, nothing you can do about that. Didn't like your color of your tie. That'd be unlikely, but you don't know what they're going to say until you say it. And asking them will give you good information for your next interview. What happens if you don't like your first position? Suppose you're offered a job at a nursing home. Let's say you interviewed multiple places. The only position that hired you was a nursing home, and you really don't want to work at a nursing home. What can you do? Keep looking for a job. Yeah, don't stop looking. Keep looking. So what happens if you get hired at a nursing home and a month later your dream job offers you a position? What are you going to do? You're going to drop that nursing job like it's a hot potato, and you're going to take your dream job. Why? Because it's your dream job. Are you going to leave that nursing home in a lurch? Yeah, a little bit. That's life. That's the reality of the situation. There are no long-term allegiances between employers and employees anymore. There just aren't. You have to do what's best for you. You need to give 2 weeks notice. You need to give them a reason. And it can be very simple. I'm giving my 2 weeks notice. My dream job was offered to me. I have to take it. And seriously, if that's the reality of this situation, who is really going to begrudge you that? It's your dream job. When you write your letter of resignation, you don't have to go into a lot of details. My name is so-and-so. I'm going to be resigning my position effective whatever date, 2 or 3 or 4 weeks, or however many weeks they require you. I appreciate the opportunity to work here, but my dream job has just opened up, or blah, 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 blah. Short and sweet. 1 paragraph, done. Come back for the third and final part of this learning plan.